Good morning.
Good morning.
Good to see you again.
Good to see you.
So it's been a couple of weeks since our last medical assessment. Can you tell me a little bit about your symptoms? Has the tightness in your chest and the ear pressure, has that improved?
Yes, so the tightness in my chest and the sort of ringing pressure in my ears has improved.
Okay.
Because I think stopping the swimming. Yeah.
Okay, so you gave it a break. Good. Okay. And no tightness whatsoever.
Right.
Good. Okay, so no tightness in the chest area and no ear pressure. And I remember that during our last assessment, you had a little bit of a mixing of sensations in your back. How is your back?
Overall, it's fine, but I've noticed this weird thing, almost like a sort of tingle happening, and it just sort of runs up my back to my head.
Okay, a tingling sensation. Okay. And can you point to where the tingling sensation originates from?
Sort of right around here.
Okay, so the middle of your back.
And then it just runs up my spine to the base of my head and then the crown.
Okay. And when did you notice this?
Shortly after our last visit.
Have you started any new medication or?
No.
Okay. Have you changed maybe the lotion that you're using on your body or your body wash, shampoo, conditioner?
I'm trying to think, but no, I don't think I have changed anything.
So no changes in just your regular healthcare products. On a scale of 1 to 10, how intense is that sensation?
It's not very intense. It's maybe a 3 or a 4, but it's enough to notice something happening.
Okay. 3 or a 4. Does it come with any numbness or any pain?
A little numbness, yeah. It almost feels like when your leg is falling asleep in the pins and needles.
Okay, got it. Any headaches?
No.
Does any of that feeling radiates towards your chest or your face?
No.
No chest and no face. Okay. Interesting. So I'm going to go ahead and do a neurological examination today. And I'm going to focus on your cranial nerves as well as your back. And we'll get to the bottom of it and see how we can help you. I'm going to go ahead and put my gloves on. Are you experiencing that sensation right now?
Not very much. It sort of comes and goes.
Okay, comes and goes. So let me just go ahead and just look at you and check the skin in the front, your upper limbs, your arms, your chest, neck, and face. Okay, so physical appearance is normal. I'm gonna go ahead and feel your pulse. Normal pulse. 12 respirations per minute, which is normal. Okay, I'm gonna go ahead and listen to your heart and lungs. Okay, is it okay if I slide this under your top? Okay, right there, just trying to listen to your heart. Okay. normal heart sound. Take a deep breath in for me and out. Okay, very well. Lungs sound normal as well. I'm gonna make a note of this. And just like last time, cardiovascular system presented normal findings. Physical appearance is normal. Heart rate, pulse. Okay, very well. So let's go ahead and do a cranial nerve exam and see if I can find anything neurologically abnormal, and then we'll focus on your scalp, hair, and your back.
Okay.
So I'm going to start by focusing on your eyes. Have you noticed any blurred vision, double vision, anything abnormal with your eyes?
No.
No, good. So in normal light, I see that you have normal pupils, they're round, they have the expected size and shape. Go ahead and look into the distance for me. Okay, I'm going to first measure your pupils. So I'm seeing about 2.5 millimeters, which is normal. Okay, very good, round and reactive to light. Look up for me. Okay. No signs of any jaundice. Now, I want you to keep your head steady, so don't move your head, don't use your neck muscles at all. And I want you to look at my nose and tell me if I'm moving my left fingers or right fingers.
Left.
Okay.
Right. Left. Right. Left.
Okay.
Left.
Good.
Right.
Perfect. Now I want you to continue looking in my eyes or at my nose, and I want you to touch your nose with your finger. Good. And now using the same finger, I want you to touch this finger here. Okay, then bring it back to your nose. Now I want you to touch this finger here, bring it back to your nose, to at the bottom, back to your nose, and at the top here, back to your nose. Perfect. Very well. Now I want you to look at the light here and keep your head steady and just follow the light. Okay. Good synchronized movement. Any pain when I do this?
No.
Good. Any pain here?
No.
Any pain here?
No.
Good. So binocular vision is intact. Excellent. Right now I want you to shrug up your shoulders. I'm going to try to lower them. Don't let me do that. Good. Perfect. You can relax. Puff out your cheeks for me. Okay, I'm going to attempt to unpuff them. Don't let me do that. Good. Perfect. And raise your eyebrows for me. I'm going to attempt to lower them. Don't let me do that. Perfect. And I'm going to attempt to push you back. Don't let me do that. Good. And I'm going to attempt to bring you forward. Don't let me do that. Good. I'm going to attempt to rotate your body. Resist. Very good. Very good. Now I want you to squeeze my arms. Okay. Squeeze them as tight as you can. Good. Perfect. So very good muscles are working in the back, and your deltoid and trapezoid muscles are all good. Very good. Now can you keep your arms like this, parallel to the ground? Okay. Not noting any tremor. Can you spread out your fingers? No tremor. Good. I'm going to attempt to push them apart. Don't let me do that. Perfect. Bring them together. Very good. Now can you do this? Okay. Perfect. And now do this side. Okay. I'm going to attempt to pull through. Don't let me do that. Very well. Excellent. You can lower your arms. All right. Now I'm going to check your hearing next. And that's still part of the cranial nerve exam. Close your eyes and I'm going to whisper a word in each one of those ears, and I want you to repeat back that word to me. Summer.
Summer.
Glasses.
Glasses. Blue. Red.
Good. Now keep your eyes closed and I'm going to make a sound and I want you to tell me if the sound is moving away from you or towards you.
Towards. Away. Away.
Okay, very good. I'm going to palpate your ears next. Checking for any lumps, any bumps. Mastoid bone process does not appear enlarged. No signs of any infection. Okay. Checking your lymph nodes. Preauricular and postauricular lymph nodes, submandibular, submental, tonsillar, and the cervical lymph nodes on the neck. Okay. Not seeing any enlargements. Very good. Now I'm going to give you something to smell and I'm going to test your sense of smell. The cranial nerves are nerves that start from the brain and they go all the way to your body. They control your 5 senses, so your sense of touch, hearing, eyes, smell, your sense of taste. So let's see if you can identify this. Smell.
Peppermint.
Perfect. All right. And I'm also going to give you something to taste. Okay, can you stick out your tongue for me? All right. What does that taste like?
Vanilla.
Perfect. Okay. So I'm gonna set this aside. Next up, I'm going to check your dermatomes. So that's going to test the cranial nerves that control your sense of touch all throughout your body. So I have here a very fluffy, dull side of my object here, then a sharp side. So keep your eyes closed and tell me if you feel sharp or dull.
Dull. Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull.
Good.
Sharp. Sharp.
Okay.
Sharp. Dull.
Good. And now I have a slightly warm and a cold object. Let's see if you can get this right as well. Continue keeping your eyes closed and just say cold or warm.
Cold.
Good.
Cold. Cold. Cold.
Good.
Cold.
Good.
Warm.
Good.
Cold.
Good.
Cold.
Very good.
Cold. Cold.
Good.
Warm.
Good.
Warm. Warm.
Okay. And next up, I'm also going to test your sensitivity to pressure. So continue keeping your eyes closed, and I'm going to touch you with a slightly sharp object. Just say yes when you feel it.
Yes. 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 Yes.
Very well. So that is all perfectly normal. Next up, I'd like to focus on the dermatomes in the back as well as your scalp. Everything looks okay in the front, so I'm going to take a look in the back as well, since that's where you mentioned that you felt those sensations. Okay, Mary Rose, so I'm going to go ahead and take a look at your back. Just perform a visual inspection first and check the skin, the neck area, I'm checking for any dermatitis, psoriasis, any abnormalities of the skin that could contribute to the tingly sensations. Not noting anything. The skin is evenly colored. The color is appropriate to your ethnicity. No signs of any dermatitis. You have a little bit of a rash here. Is that normal for you? You have pretty sensitive skin.
Yeah, it's what's the name for it? Keratosis pilaris.
Okay, so a little bit of keratosis, I see. Yeah, I get this too sometimes. That's usually the case with sensitive skin. Okay. I'm gonna go ahead and palpate your back. I'm gonna remove my gloves and sanitize my hand. Do you feel any of those tingling sensations right now?
A little bit.
A little bit, okay. Starting from the bottom here?
Yes.
Okay. Temperature is even. The bottom of the lumbar spine. Okay. I'm going to palpate. Check for any lumps, any bumps. Okay, the spine is straight with no indentations. Moving up the thoracic spine and the cervical spine. Normal curvature and no indentations in between the vertebrae. Okay. I'm going to slide a very fine, slightly cold object down your spine, and I'm just checking for the spinal response. Okay. Good. Sensitivity is present. Okay. I'm going to go ahead and focus on your scalp as well, and then move my way down on your back. Is it okay if I unclip your ponytails?
Yes.
Okay. We're going to take a look at the hair and the scalp. So I'm doing a scalp inspection and checking the skin at the base of your head. Just normal. Normal hair distribution. No patches of hair loss. No breakages. Dermatitis is not present. No alopecia. ahead and continue the back exam. Checking the temperature distribution. Normal across the spine, normal laterally, slightly getting colder towards your hands and arms. It's normal. I'm going to touch with a slightly sharp object. Just say yes when you feel it.
Okay. Yes. 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 Yes.
Good. I'm going to go ahead and percuss your back and listen to the resonance of the sounds that come out of your thoracic cavity. Alright, now we're going to do a test that's called dull or cold. So this is dull and this is cold.
Okay.
Okay, so go ahead and say dull or cold.
Dull.
Okay.
Cold. Dull. Cold. Dull. Cold.
Alright, so that's a normal neurological response to dull, cold, and sharp. I'm going to go ahead and perform some acupressure therapy on your back. This is going to help relieve the muscles and the tension and loosen up your back muscles a little. Okay, I'm going to focus on your trapezius muscles at the top of the back. Good. And your deltoid muscle. And your latissimus dorsi muscle. The one that's helping you turn. And the levator scapulae. Okay, good. All right. I'm gonna go ahead and put some oil on your back and perform a light massage. also going to do light cupping therapy. This is going to help stimulate the area and bring the blood towards the surface, promote circulation and relaxation. I'm going to take a couple of measurements. Okay, take a deep breath in and out. Okay, now I can just breathe normally. Lungs sound normal. All right, Mary Rose, you can put your top back on and we can discuss the results.
Okay, thank you.
Okay, Mary Rose, this concludes the assessment for today. I did a very thorough investigation of your cranial nerves. I focused on your back, your scalp. From a neurological point of view, everything is okay. So I think we can just monitor the tingling sensations. And maybe you can come back in 2 months and then we can see where we're at.
Okay.
Sounds good? Yes. All right. Great seeing you today.
Good seeing you too.